77-year-old Pope Watson and his wife Carolyn are not only proud grandparents, they are also proud great-grandparents. They enjoy sorting through pictures of the little ones on their computer.
I think he's a gem.
Little do his great-grandchildren know that a trip to the doctor for wheezing may have saved Pope's life. While doing a CT scan of his lungs, doctors found an aortic aneurysm in his abdomen. Pope was taken to the operating room where Dr. Ross Milner, a vascular surgeon at Emory, repaired the aneurysm using an aortic endograft, a technique where a fabric-covered metallic stent is placed inside the aneurysm to prevent rupture. Pope also enrolled in a research study and had a small sensor implanted in his aneurysm to monitor its pressure.
We're involved in a study looking at pressure sensors because one of the questions with the technique is how do we follow our patients after they've had the repair?
Typically, after an aortic aneurysm repair, patients must have multiple CT scans with contrast dye to make sure the aneurysm is not growing. Continuous contrast dye can be dangerous to the kidneys.
What we're looking at is hopefully trying to replace all those X-ray studies and implanting a sensor at the same time that we put in the aortic endograft that will measure pressure within the aneurysm, just like a blood pressure cuff.
There's no risk to the patient in getting a reading from the pressure sensor. A tennis racket-shaped device is held over the abdomen, and when activated, it displays the pressure reading on a computer screen. In the study, participants returned to the doctor's office 1, 6, and 12 months after surgery, and then once a year to have both the standard CT scan and pressure sensor reading. Since there are no known risks with sensor readings, doctors say patients could be monitored more often, so any problems could be picked up earlier. Pope had no reservations about enrolling in the study.
It's part of the progress of medicine to be able to do things like this for future generations, and I was in favor of it for that reason.
For Emory, I'm Rhonda Rowland.